Hi, Robin.
Hey, hello.
Welcome.
All right, we are set. We are live now. We've got about 22 folks on the line. Lillian, I will be passing it back to you.
Sounds good. I really should have figured out how to play some intro music or something, huh? Next time.
Yeah, the
Unless
elevator
someone wants
music
to
comes in handy, huh?
Uh-huh. I mean, unless you want to serenade us, George.
I don't know.
Thanks, Teresa. I will not be singing right now.
So Robin, I understand that you're going to help with the presentation this evening.
Indeed.
Great, thank you.
Take your hand off, George. Anytime.
I'm just glad I don't have to do that much talking.
Just sorry I was never as cute as any of the children in this picture. It's giving me a retroactive complex.
These are staged children, clearly. They're not real children.
There's someone's real children.
Yeah, somebody's, yeah, but I'm not so sure that my grandchildren even don't necessarily look disorderly, so.
Well, this is not a video, it's a snapshot, right? So
That's right.
one
We
quick
don't know the
moment in
chaos that was
time.
happening before or after.
That's right.
Yeah, if it's even in a snapshot though, even if it was my grandkids, they'd be leaning all over each other and wrestling and all kinds of, looking
the
in
things the kids
all
do.
different directions, right? Yeah.
All the things the kids do.
Right, it looks like we've got about 36 attendees joined us early. Thanks so much, everyone. We've still got a few minutes left.
Just want you to all be aware, yes, exactly. This is being live streamed. So our poor listening audience, you showed up early and you get this, sad warm-up act.
Prepare some jokes for next time.
George, shouldn't you have a picture that shows you with the full, beard and mustache?
I haven't had it long enough. It's only been the last, since the spring. So I haven't taken too many pictures then because I haven't gone that many places.
I think you need to capture this COVID look, if that's what it is. It's very distinguished.
Yeah, and who knows how long it'll last, so.
That looks like Tom Bennett. Is that Tom Bennett right there?
Hey, Representative Davis, good to see you.
Good to see you too. How you been?
We're doing good. We are doing good.
Fantastic.
The summer's going by quickly, though, isn't it?
Well, I think summer has already gone.
Well,
So,
well, December's here, though. I mean, it's going by quickly. Yeah,
oh, I thought you said summer, not December. I'm sorry.
December. It's all right.
December. Okay.
Technology works great, but there's limits. So, no, it's good. It's good to see you.
It's good. It's good. Thank you. How are the students down in Pontiac High School doing?
They've had some, well, just today I was helping Paul Ritter. They're doing some projects with students, presenting them online today. It was really pretty cool. We'll find out more. They did today and yesterday, so I haven't had a chance to talk with Paul to see some of the final results, but they talked about some projects, some creativity, some originality, and it was very cool. So we'll see. It's the first time I was able to be part of that, but Paul's doing great. He's thinking about a number of things. He's got some ideas. He wants to help provide some things for the legislature to think about. And so you and I will probably be talking here sometime in the near future, but it's
That'll
all
be
good.
great.
Yeah.
Look forward to it. Thank you.
Paul loves to include the kids. It's wonderful.
Absolutely.
Sorry to interrupt you, representatives, but we are at 8 o'clock. And before we get started, I'm going to tell a joke and you're going to tell me how good it is. Okay.
Okay.
What did the 0 say to the 8? Nice belt.
Pretty good.
Okay, great. Thank you for
That's
humoring
very
me.
good.
I'm just happy I got it.
And welcome to all of you and to all of our 86 participants. I'm sure people will trickle in, but thank you everyone for joining our second of 4 Early Childhood Funding Commission town halls this evening. My name is Lillian Matsuda and I am from Illinois Action for Children, which is just one of the 120 plus organizations that make up the Early Childhood Funding Coalition. And we are honored to be here in partnership with the Funding Commission for tonight's event. Before I hand the mic over to Commission Co-Chair George Davis and Robin Steens, I will first review our agenda and a few logistics for tonight. If you haven't done so already, please take a moment to click on the participant list and change your name so your fellow attendees can get a better sense of who their town hall neighbors are tonight. And all you have to do is find your name, click on it, and input your first name, your role, and what city you're coming from. So for example, my name says Lillian, Illinois Action for Children, and Chicago. We're happy to offer live Spanish translation for this town hall. So you should see the option to listen to the town hall in Spanish by clicking on the interpretation icon at the bottom of your screen. And this will be my friendly reminder for anyone speaking tonight to please keep our very talented interpreter, Steffi Hernandez, in mind and not to speak too quickly. This is our agenda for tonight. After I review a few more things, I will pass it over to our commissioners. We'll begin our Q&A right at 8:25. And finally, we'll conclude the evening by sharing a couple of opportunities of how to stay involved with the topics you hear about this evening. Because we'd like to get a better picture of who has joined this town hall, we have one question for everyone before we move ahead. So I'm going to pull up our poll. Here we go. So please click the option that best describes yourself, and I'll give people a few seconds or so to select the best answer. Always nice to see who's joined us at 8 o'clock on a weekday. All right. Interesting. So you've got a good representation for from directors, owners, and administrators. Some fellow advocates in the room and home child care providers, parents. Maybe I'll just leave it up for a couple more seconds. I know some people are still joining. All right. Thank you so much. Close this out here. Okay, so for participation, there are two ways to participate during the Q&A. You may raise your hand by clicking on your name and then selecting the raised hand icon, and a coalition member, Jessica Ramos, will unmute you so you can ask your question to the commissioners directly, or you can type your question into the Q&A box. Members of the coalition will be monitoring the Q&A box as questions come in. And I will say we will do our very best to get to every question, but it is likely we will not be able to do that. So please know that the questions will be saved, and after the town hall, they'll be routed to the commissioners and any other appropriate party. If you want to live tweet on Facebook or live tweet on Twitter or post on Facebook along with us tonight, don't forget to use our hashtag, which is AllInForEarlyEd. And thank you again to our coalition partner, Advance Illinois, for providing the live streaming on YouTube. And finally, these are our community agreements for this evening. Oh, sorry, looking around here. Please respect the opinion of others, even if you do not agree. Speak as openly as you feel comfortable. Everyone is encouraged to participate. Listening is as important as speaking, and common courtesy is always exhibited. And with that, I will pass the Zoom mic to George and Robin. And as I said last week, forgive me if I interject momentarily just to keep us on schedule for the Q&A portion. But for now, over to you.
Thank you, Lillian, and good evening, everyone, and welcome to tonight's second in a series of 4 town hall meetings hosted by the Commission on Equitable Early Childhood Education and Care Funding, and supported by the Early Childhood Funding Coalition. My name is George Davis, and I'm one of the 4 co-chairs of the commission. Joining me tonight, there are other commissioners, and I would like to take a moment to ask each of them to introduce themselves before we go on.
I'm Christina Hachikian. I am a professor of clinical associate professor at the University of Chicago Booth School of Business with a specialty in nonprofit management.
My name is Tom Bennett. I'm a state representative of the 106th District, and glad to be with you. Thank you.
All right, good evening. My name is Will Davis. I'm state representative of the 30th District in the South Suburbs.
Elliot Regenstein. I'm a partner at
And I'm Robin Stain.
Policy based in Chicago. Sorry.
Hi, and I'm Robin Staines. I'm a former high school teacher and president of Advance Illinois.
Thank you. Are there any other commissioners that we missed introducing? If not, thank you again for everyone for joining us tonight. There will be actually 2 parts to this meeting, basically. First, we'll begin with an introduction to share information about the work of the commission over the past year. And then secondly, the other commissioners and myself will take questions about our work and have a conversation with you about those recommendations, which is really the main goal. So without further ado, we'll move into the overview of the commission's work. First of all, the commission was charged with recommending improvements to the early childhood education and care system of services in our state. The commission, it says, I'll just read this, shall study and make recommendations to establish funding goals and funding mechanisms to provide equitable access to high quality early childhood education and care services for all children birth to age 5 and advise the governor in planning and implementing these recommendations. So on the next slide, we can see a bit more detail about the commission's charge. So the commission was really focused in 3 areas. Overall, of course, we want to look at the entire system, including childcare and centers and homes, childcare subsidies, home visiting, preschool, early intervention, early childhood special education, family, friend, and neighbor care, and daycare's licensing. But there are basically 3 areas that we are focused on in this work. First of all, those goals related to funding, which includes really the type of investments that are needed in order to provide adequate funding for early childhood education and care in our state. So that was one of the most basic questions that we've been exploring. Secondly, the mechanisms by which this funding actually flows to providers and therefore to families and communities, and how should those services best be delivered. And then third, planning and implementation of the recommendations, which is the all-important, as they say, devil in the details. How ultimately will the implementation of these recommendations be moved forward in a way that actually achieves the goal and purpose of the commission's work? So next we want to show on the next slide a little bit of an overview of why the commission was created and why this work is so important. So Illinois has a history, as many people know in this state who've followed early childhood education at all, or been very close to it at a policy level or at a practice level. But you may not be aware, if you haven't really been someone who's taken a lot of time to look at the entire system, that Illinois is really a national leader in some areas, including home visiting services, and is one of the very first states to even make this kind of a robust investment in childcare that we've made, and really to fund preschool is one of the earliest states to do so, including really cross-system supports. This is a state also that really has emphasized, really from very, very early, the importance of serving both 3- and 4-year-olds, even at the preschool level, which is not something that every state has opted to do. So it's time, though, to reflect on really how adequate and even the access to services are in our system, even with all of the innovations and the leadership that we've done. Because we still really are facing a situation with wages for our early childhood professionals and low kindergarten readiness as challenges that we still have not really fully dealt with. So that says that as much work as we have done in the past, we still have much to do to create an accessible system that really actually supports the highest quality in terms of professional investments, so that the professionals who do this work can really get the kind of support that they require. And we have to still ultimately look at the bottom line, which is how well are our children prepared to succeed by the time they reach school at the age of kindergarten readiness. So at this point, we want to just take some time to envision an early childhood system that provides equitable access, high quality services for all children. One of the other realities is that the evenness with which the access to quality and access to services in our state is not really something we can say that anywhere you live, under whatever circumstances, that you can be assured that your child will have access to the highest quality early education. So that's one of the main important really aspects of this work that's still really critical. Universal access, high quality, and the assurance that the best prepared professionals will be providing the services that all Illinois families really deserve. So on the next slide, we want to look at the principles that guide the Commission's work. These principles include high quality, equity, bold change, building on past success, family choice, stability and sustainability, accountability, and implementation readiness. A lot of big words and big concepts in a way, but really what it amounts to is that as we do the work of creating a more accessible, equitable, fair, universal system, we have to make sure that we are paying attention to certain important things. We want to make sure that the services that are provided are not only available, but the highest quality possible based on what we learned about what makes for a high quality system. Equity has to do with the fact that, again, we have still significant disparities, not only in who gets these services, but really where the services are provided and what choices parents have at a given point. So equity and choice, family choice, are often go kind of hand in hand. But we also know that some groups of families and some places in our state really have experienced disparate impacts around educational attainment and often kindergarten readiness and preparation for kindergarten as well. You know, those disparities are both expressed in terms of racial inequities, equities of those inequities impacting those who whose homes speak a different primary language other than English, children with disabilities, those who might live in rural places, and so forth. So we have to pay attention to whether our system is truly an equitable one. And we know that parent and family choice is a foundational principle upon which our services need to be based so that we honor the services in the way that families can best receive them. And building on past successes is important. As I mentioned, some of the strength of our system from some of the work we've done in the past. We don't want to look at our system as one that's broken, because it's not. It's a system that has a lot of strength and a lot of capacity. And we want to look at ourselves as building on those strengths and making them stronger. So stability and sustainability, it's very clear that unless we build a system that can be continually improve and improving and ensure that there is stability with regard to the resources provided, then none of the other goals will really be possible. And accountability, we ultimately have to answer to our communities, to our families, to our public for the results. And so it's not just about access, it's also about outcomes, and it's also about being transparent. And then we have to face some realities when it comes to going from the concepts or ideas or the things that we say we want to do, and what will happen when we actually start to implement those things, because certain realities come up, and you'll hear some of those that you all will ask questions about tonight, and that maybe we will be able to address also as we finish our presentation today. So with those sort of overview ideas and just background as to why it is that we're doing this work, we want to really move into, in the next section of this brief overview, into talking specifically about what are the recommendations that the Commission has developed so far, and what do those look like. And I'm going to call on fellow Commissioner Robin Steens to lead us through this next part of the discussion. Robin, I think you're on mute.
I've done it. All right. Thank you, George. I will pick up. And I'm going to, as we move into the recommendations, I do just want to make one comment, which I think is shared by all the commissioners on the call, which is, Illinois does have a history of being a leader in early childhood. And the chance to sit back, reflect on where we are, where we need to go, and what it's going to take to get there is a rare opportunity. And so while there's lots of innovation, I think for all of us, you guys can correct me if I'm wrong later, that we really appreciate that the governor thought to put the mission together and to really tackle some of these longer term issues. It turns out that doing so before COVID hit was prescient, because the issues that we had going into this conversation, and I think it's the 1 year anniversary of the first meeting was right around now. As a result of the pandemic, it has really laid bare some of those issues. So just really appreciate that we've got some of the recommendations. So if you move on, am I breaking up still for folks? Can you hear me okay?
Yep, you're
All
coming in
right.
clear now.
Excellent. Just keep popping in the chat if I need to like lean in or something. All right, the commission, as you can see here from these children who are even more adorable than the earlier children, still more adorable than I was. There are three major areas that we have been exploring, and we've got 3 draft recommendations that are beginning to emerge, and I want to walk you through those. So, slide. We have drafted those recommendations. We've begun writing our final report, and maybe I am still supposed to be on slide 12. I'm sorry, go back. That's all me. It is important for you guys to understand we have been seeking input from stakeholders along the way throughout this entire year. These town halls are yet another opportunity for us to field questions, for us to get some thoughts before that final. And it is issued, which is going to happen in March of this year, and it'll go to the governor, or excuse me, of next year. I'm already in favor of putting 2020 behind me. I've already started focusing on 2021. The 3 different parts of the commission's charge are what have driven these recommendations. So there's a recommendation focused on funding adequacy. There is one on the mechanisms that we ought to be looking at to distribute funding, and a recommendation focused on how the system ought to be governed so that we can be more holistic and more strategic. We've also started discussing the next steps in the work once we've submitted the report. What needs to happen next? How do we answer the many unanswered questions? And some of those are going to come up today. You're going to ask questions. You're going to want answers to particular issues. There is lots more. There's some work that we have addressed. Then there's a lot of work that we're still going to have to keep working through moving forward. So let's first take a look at the funding adequacy recommendation. Slide 13 shows what the commission, as we've done this work, believes a high quality, equitable experience for children ought to look like. We constructed a model of what it would cost to provide equitable access to early childhood education and care funding for all children age birth to 5 in Illinois. The model includes the kind of things that you see on the slide, with the goal of creating a high quality and equitable experience through the eyes of both families and children that we're serving. It does not include exactly what it would take to cost to get from here to our ideal state. We believe that that's important work that we're going to be continuing to dig into. So you can see the kinds of things it includes. I know that this is going to resonate with many of you, that we want to make sure that we've got staff who are appropriately paid, that we've got the consultative services, the family engagement, the supports for children with special learning needs or multilingual needs, the mental health supports, etc. So it's comprehensive, which means it's going to be a big number. Our first recommendation on slide 14 is that early childhood education and care, because if we really want the system to look as good and as strong as it needs to, is going to take billions of more dollars in funding that we're going to have to find a way to develop that over time. Obviously, we're not going to be able to magic that up out of thin air. So this is going to be a longer term prospect. We believe, as we do the analysis, that it would take an investment of over 6 times our current annual investment to provide all of the things shown on the previous slide. I want to emphasize that again. That is a huge uptick. I think all of you who are on this call, who work in the field, recognize the truth of that we're really not close. We're not close in the services we provide, need more resources, but as well, we've got way too many gaps where there aren't resources at all. This is funding that is going to need to come from federal, state, and local level with support from philanthropy where possible. And of course, it's a very large investment we're talking about that the state will need to build up to over time, relying on support from federal partners. That said, some of you may say at this time when we know our budgets are hard hit, why are we even talking about this? The commission and the commissioners believe it was important for us to set a funding adequacy goal. A goal does a couple of things that are very helpful. First, it helps us figure out where do we need to go. You don't get places unless you're clear on where you need to go, and it helps guide policy decisions along the way. We also recommend that the cost model be updated regularly and that we put in place an advisory body who can routinely update, examine, and make sure that the number is correct. There's also more work to be done honing the adequacy goal. This was a major undertaking. I want to emphasize this was a major undertaking. Understanding what we should be spending across a very complicated early childhood education and care system was no small feat. We do, not surprisingly, and we've got an overall recommendation to make, but there are areas I think we can all agree that need a little more fine tuning, especially in the area of family, friend, and neighbor care, each of which are very complex in and of themselves. Our second recommendation on slide 15 is to centralize funding delivery from the state to providers so that it is more stable and more equitable. Currently, early childhood funding, as many of you know and live with, is distributed through a mix of contracts and certificates. This process is generally uncoordinated, and it can disadvantage providers that don't have the resources to go through the application process for a contract such as Preschool for All. So for these reasons, the Commission is recommending that funding be centralized at the state level and that the state use a more targeted grant-making process to distribute funds. These funds can be for services such as education and care or home visiting. They can also be used for support such as professional development or community systems. The Commission also recommends that the state support providers in this process so funds can be more equitably distributed. Separately, the Commission believes more study is needed on the ways that early intervention and early childhood special education funding is distributed. These funds are particularly complex, as many of you know, relying on Medicaid funds as well as local funds. And the Commission believes more providers need to be part of the process of improving how those funds are distributed. And it's important also to note that this recommendation would be implemented over several years with providers closely involved in that process. This is not a change that can be made overnight for all providers. So I don't know if that will ease anxieties or make people sad that there's some time built in to many of the steps here. Slide 16 shows that the benefits the Commission members believe could come from a system that relies more heavily on grants and contracts. Ultimately, this type of system has the potential for less bureaucracy and more stability than we see in our current system. Less time, we hope, spent on administrative burden, which allows for more time doing what everybody on this call wants to see happen, serving young children. More stable, predictable sources of fundings also makes it easier for providers to stay in business, to invest in quality, to receive timely payments, and to generally to plan with a more longer term horizon. More providers may work with the state, and that allows us to get more services to eligible families. And finally, an equitable funding delivery can mean greater equity for children and families. And so having that control and blending and braiding upstream rather than at the local level allows us to be more strategic and equitable. So the Commission's third recommendation is on slide 17. And it's to centralize early childhood services into one agency. This would include all the services that are seen on this slide. However, the Commission believes that further study is needed here as well for early childhood special education, which is currently part of the state's evidence-based funding formula. And for various reasons, there are reasons to be careful about dislodging that, at least without some further thought and discussion. Happy to talk about that more if we go forward, if people have questions. The Commission also believes that centralizing these services in one state agency would help create a new unified system with the capacities you see on the top of the slide. As I think folks may realize, currently, our system of early childhood education and care is spread over multiple agencies, which makes it difficult to think strategically, holistically, and equitably about what we do and how to use incremental programs and dollars. I want to call out especially that the Commission believes a centralized service at the state level should also come with unified regional and local community system support. These community systems can help providers to build capacity and can help connect families to the services they need. These community systems will be critical to ensuring equitable access to services in our state's most underserved communities. Slide 18, if I can move on, shows the benefits the commission believes could come from centralizing early childhood services into one state agency compared to spreading them across the multiple agencies where they are. There's tremendous potential here to simplify the way providers interact with the state, create more transparency, make it easier to get information, and serve children and families more equitable. It's a quick case in point, K-12, we have annual report cards. We talk about how our system is doing, and it's all in one place. Wouldn't it be wonderful if we had that kind of combined holistic report on what's happening in our Birth to 5 system? What are our goals? How are we doing? And what are some of the issues going forward? So again, just to recap, you can read this, but centralizing allows us blending one simple application for services and funding instead of multiple. Easier to find programs. There's one place to go. You don't have to wonder where it is. It's just in one place. Coordinating those resources, we can be clear about what quality is statewide. My video is off. I don't know if that matters. The host has stopped it, but we won't worry about that. Can share better information on program quality and cost. Better transparency. When you've got a problem, you're going to know exactly who's responsible, and more equitable funding distribution. We move on to slide 19. It's important to recognize that the work doesn't end with the commission. For recommendations as big as these, as we've mentioned, the devil really is going to be in the details. There are lots more questions. You cannot make the kind of big changes. You cannot make the big changes that are going to be required without lots and lots of in fact, I would be quick to say not only are there more questions to be unpacked, but I think the point is that we want to organize ourselves so that we are constantly improving, but the way in which we're doing that is more coordinated and better going forward. So as we answer those questions, the other thing we want to emphasize is we want to continue to include as many members of the early childhood system as possible. That's why we're having the town hall tonight. That's why we had one before. We've got a few more coming in January. We really look forward to hearing your questions and your thoughts on these proposals. So, and I apologize, it sounds like maybe I've been, my audio has not been great. I hope you've been able to follow. We really appreciate you for listening to this overview. I want to invite any of the other commissioners on the call, if there are points that they want to emphasize or make before we open it up to question and answers, provide additional information. This is the perfect time to do that. And then we'll turn it over for Q&A.
Robin, I've given you full control back over your video again, but I think it did help with the sound connection, but I think we got you all the way to the end. George or others, are there anything else you'd like to add before we move into the Q&A?
Not from me at this point. I don't know if other commissioners have any other points.
If I may, George, and I apologize for being off camera, I'll correct that momentarily. I just hope for the participants who are on the phone that they appreciate the time and effort that has been put into getting us to this point. And we understand that these kinds of things, if I can call it that, are always better when they are informed by those of you who are on the call, providers, practitioners, advocates, what have you. We know where we're headed, not going to be easy to get there. But we appreciate, again, all the commissioners and all their work. And certainly for those of you who've been able to follow, please continue to follow. This is one of those things that we hope to get right the first time, but certainly if it's not the case, we're certainly willing to come back and make those corrections. But you help inform this discussion in ways that you couldn't believe. So thank you for being on the call, and we look forward to your comments and your questions. Thanks, George.
Thanks, Representative Davis. Elliot, you had a comment as well?
Yeah, and I really appreciate, I totally want to second Representative Davis's comments and also everything that you and Robin said earlier. I think for the audience tonight, that a lot of us on the commission, part of what brought us to this work and excites us about the possibilities is the recognition that what really matters is what's going on in those direct interactions that providers are having with children. And the recognition that the state has over the years in bits and pieces tried to establish supports for those providers, but that it has been in bits and pieces, and that now is the time to think holistically, as Robin said, that part of the challenge we face, and you can see this even in some of the questions we've gotten already, is that there's no one entity at the state level that's even empowered to solve the full range of the problems that providers are facing, or to build the expertise that's needed to address those problems. So I think we're really hoping that our proposal, which again will benefit enormously from your feedback, will help create a world in which the state can be more supportive of that local level service provision and be a better partner than it's been able to be in the past. So that's not a knock on any of the staff in current roles at the state who are all working hard in the way the system's been set up, but if we can set up the system better, we can do better. And that's what I think is exciting about this possibility.
Thank you, Elliot. Any other commissioners have any other comments to offer? Okay, well, if not, then this really leads us to where we really want to go next, which is really your questions and comments about what you've heard or learned so far. I know, as Elliot mentioned, I see the number of questions and comments have already been received in the chat. So I don't know if we want to start with those or if we want to start with those who are wanting to speak. Yes, go ahead.
No problem. Just so everyone knows, we've now reached the Q&A portion of our town hall. So please just review the ways in which you can ask the commissioners questions. We ask that if you do raise your hand to speak, please keep your fellow town hall attendees in mind and limit your question to under 1 minute in length. And so, Jess, what I'll do is I'll just take a couple of questions from the question box and then pass it over to you for some live questions. And also a friendly reminder to our commissioners that we are doing live translation. So maybe go on your slow speed and use as few words as possible, if possible. So I saw some questions about kindergarten readiness. What strategies does the commission plan to implement to close the widespread gap of disparities kindergartners in kindergarten readiness?
I'll take first crack at that one. I'm gonna leave some of the harder ones for you guys. This is a huge question, but the reason that in some ways it's a simpler question is that we're not well positioned to state right now to tackle the question you're asking strategically, precisely because programs and resources are spread across multiple districts. It's very difficult as a state to come together. It's not that we don't have the Governor's Office of Early Childhood Development, so there are places where there are opportunities to coordinate, but that's very different than having the responsibility sit in one place. So the commission isn't saying, here's how we're going to solve that problem. The commission is stepping up and saying, we need to do better than try to do a short-term answer. We need to reorganize the way we tackle that question. That is the driving question. When the governor first charged the commission, he said, we want this to be the best state in the country for raising a family. We want this to be the best state in the country for having young children. Because when you've only got 29% of your kindergartners starting kindergarten ready to go, and when the disparities by race, by income, by language ability, by citizenship are already profound before kids even get to kindergarten, we're not doing that as well as we can. And we need to have the ability to tackle that problem, which right now, honestly, we don't. And so, our answer to that is, and in some ways it's a very unsexy answer, but in other ways it's the most important one, which is that we structurally have got to have one place where all of the programs, all of those conversations are happening. That said, piece of the puzzle also is getting the resources where they need to go. And so giving people a better understanding of what adequacy needs to be and a better understanding of being able to, when you put everything in one place, the other thing you're able to do is to drive the resources where they are needed most. And I think I saw other people mentioning the evidence-based formula that we're using now in K-12, which does exactly that, I think has really motivated the state. If we can pull that off in K-12, we ought to be able to pull that off in our birth to 5 system as well. It is much more complicated, as we all know, many more funding streams. So I think every bit of the effort here is designed to change the way we do business so that we can tackle that problem and see demonstrable results and hold ourselves to those over a period of time.
You know, to build on what Robin has just said, I would add that part of our challenge is that our systems do not really help us with regard to looking at and addressing the needs of families holistically. The issues that young children face before they get to kindergarten are not just issues that exist in the early childhood system. They exist for families, and in terms of the issues and challenges they face in providing for the needs of their children, as well as in the ability of families to access those services without a tremendous amount of barriers. When you look at how complicated it can be for a family to find and gain access to the highest quality services and to have all the other supports that they need for their child to be healthy and safe and so forth, as important as we sometimes think our efforts are in terms of the families we are reaching, there are many families that we're still not adequately supporting. And it's not any one individual's or one program's fault. It's the fact that we have developed a system that allows for huge inequities and disparities around how a family gets to the services, whether they can find the right services, and whether they can actually get into those programs, or even whether they're aware of them. So there's a lot of things we have to fix before we can even begin to talk about closing those gaps in a really serious way.
Well, I don't want to kind of steer the conversation in a different direction, but one of the things that we are going to be challenged with is when we look at our state and talk about the disparity that exists. So one of the things that we did in EBF was we had to acknowledge that some areas of the state were just better funded than other parts of the state. And so the emphasis was to really look at the school districts that did not have the resources and target the resources to those areas first. So I say that to say, as I look back through one of the comments in the chat, someone was just talking about, accessing childcare, and they said, what's the, let's examine the difference between a mother trying to access childcare in Barrington versus a mother trying to access childcare in Cairo. Now, admittedly, I'm from the South suburbs. I don't spend a lot of time in Barrington. But when I think about Barrington and places like that, I think are wealthy communities. So, someone's going to have to enlighten me to understand why is there a child care issue in Barrington, Illinois, where they have a lot of resources, and versus a place like Cairo, which doesn't have any resources. But that's just the difficulty in being able to tackle this problem, because presumably that the folks in Barrington will probably still say, it's not available, it's not accessible. We still need subsidy, we still need resource, and so these conversations are going to be difficult. So let me just say that they are going to be difficult. I get what we're intending to do, which is to make childcare accessible and affordable across the state. But when we look at the disparities of things that exist in the state, it does make those conversations a little bit difficult, particularly when we're talking about limited resources, a finite amount of resources, if you will. So, again, let's strap ourselves in, let's get ready for the tough conversations and have open and honest dialogue with each other about what the needs are, where they are, and why we examine the needs differently in one area versus the other. And again, admittedly, somebody's going to have to explain that to me about Barrington and why someone can't access good, presumably affordable childcare in Barrington versus an area like Cairo. So thank you.
Thank you. I think, oh, sorry. Go ahead, George.
I know we don't want to take this too long with this, but I do want to make one other observation about one of the proposals that's coming out of this work. To Representative Davis's point, is that we have to have stronger partnerships between the state and local communities around addressing these issues, the ones that he raised, because it can't all be done by the state alone or even a centralized state system unless we have strong local systems of care and support that are paying attention to and trying to close those gaps as well. And also looking at ways of finding, effective ways of better coordination, planning, and better deployment of resources where they do exist, as well as in places where they don't exist, making sure that the folks in those communities are deciding what resources are needed and can really make sure that they're working together to go to the state to make their situation clear, so that we're not depending on a system that's only driven out of Springfield, but one that also is driven mostly at a level of local communities. Again, this is ideal, but how we get there is still remains to be seen.
Thank you. All right, Jess, I'm going to pass it over to you for a couple live questions.
Thanks, Lillian. So first question is coming from Josie. Josie, I am giving you the privilege to talk. Please ask your question. I believe you're able to talk now.
I think maybe we're having some connectivity issues.
Josie, please try to ask your question over the chat and I can elevate it and I'll go to our next person in the meantime. Francine, you are now unmuted. Please ask your question.
Hi there. Can you guys all hear me? Okay, perfect. Yeah. Okay, hi. My name is Francine, and I am the owner of some programs up here in Lake and McHenry counties. And Representative Davis just mentioned Barrington, and that's very close to my locations. And he had asked, what are the needs in our locations that need to be addressed? And overall, I'm pretty much thinking that our system is broken. Our early education system is definitely broken. It is affecting our areas up here in Lake and McHenry counties, which incorporates Barrington. And we are very much, our needs are centered around staffing and the pay that staffing receives compared to what our centers could afford. We've also seen some demographic shifts in McHenry, where we have a lot more lower income families who need care, but cannot come into our care because they can't afford the co-payments. So I believe that across the state, even though some areas might be in more need, I think entirely the overall early education system is entirely broken. And I think that change is necessary. So my question would be, if, the areas up by me, which consist of Grays Lake, Volo, Wakanda, McHenry, Woodstock, those areas up here, Barrington included, how will this system affect our programs to fix the brokenness and to allow us to thrive in a more elevated system that incorporates, you mentioned wealthy, they're not wealthy over here, they're middle to low, middle class, low class, I guess. The affordability of care up here is expensive, and to get 1, 2, or 3 children into care as a family is pricey, and especially with the high cost of what it costs to have running a childcare system at the level of quality that the state receives is expensive. So will this funding commission also include parts such as our areas of Lake and McHenry counties to encompass everything as a whole? So I guess we just don't want to be excluded. So I'm wondering if the commission has given consideration to our areas.
Right. I don't think that the intent behind any of the recommendations is to only look at just certain places or certain areas of the state, even though we do understand that there are, disparities are relative, the biggest thing, this is just my perspective, is that in many cases, the difference is that in some parts of the state, there are more providers, but it doesn't mean that those providers are doing great. You know, there are parts of the state, as Representative Davis mentioned, where they're just not even providers. And that's a different type of an issue. But the issue you raise is really more, even in places where there might be providers and even multiple providers, how well are they really doing and, you know, and being able to provide their services? You mentioned the issues of pay equity, or just from a standpoint of childcare and early childhood education in general, as a professional field. Even if you're in a community that's relatively more well off, or even considered to be relatively affluent, you still might have a system in which the people who work in those professions are underpaid. So you still might have difficulty attracting and retaining high quality professionals in your center. So the intent is to really address the entire system in that way, but recognizing that the investments that we're going to need to ramp up to eventually, as was mentioned, are going to take quite a long time to reach. And in the meantime, we're going to have to think about how we prioritize, places that we can help at least get closer, and to really continue to work on and gaining the resources we need, and changing the systems in a way that all providers benefit, and therefore families benefit. So it's not really at all the intent to just target certain places in the state.
George, if I may add on, I think there's a couple of really important points that are worth noting here. One is that one of the problems in addressing this statewide is that we're so often stabbing in the dark because we don't have good information about what's actually happening at the community level. And that if we had richer information about the interplay of preschool and childcare and Head Start and other kinds of services that families are looking for, that it would help us make much better decisions about resource allocation and allow us to be more supportive of community level leadership. It's also the case that, you know, I completely agreeing with Representative Davis's point that one of the goals at the state level is to prioritize communities that have been underserved. In every community, regardless of what level they're at or how much funding they have or how much private resource they have available, the system is broken. And one of the things that the state can do is help support local efforts to solve that problem, because the problems in the south suburbs of Cook County do not need to look the same as the solutions in Lake County or the solutions in Cairo. I mean, anywhere you go in the state, there are going to be subtly different problems that the people in that community are better positioned to solve than the folks who work for a state government directly. So part of what we've been thinking about, and we're not going to solve this problem completely, but we want to advance the work and set up the final, additional work to solve it, is how do we help every community in the state have the local infrastructure they need to make good decisions about the best way to see that families and children get served in their community.
Thank you. Jess, I'm going to pass it over to you to see if we can get Josie back on the line, and then for one more live question. And friendly reminder to anyone with a live question, please keep it under a minute, as we're moving quickly through our Q&A. Want to make sure we can get to as many questions as possible. Thank you.
Josie, let's try it again. Josie, are you there? Looks like we're still having some issues. All right, I'll turn it to Erin. I just unmuted you.
Hi, my name is Erin May. I'm a master kindergarten teacher in the Chicago area, and a Teach Plus Illinois Fellow this year. And I'm going to make a public comment. A few years ago, my school had a full day kindergarten schedule created by administration, and it was without input from teachers, but it used every minute of the day for meaningful academic content. The results were massive daily meltdowns across the grade level. And when the teachers identified that this well-meaning schedule was stressing kindergartners out, we advocated for breaks, and then mid-year administration changed the schedule in response to teacher voice. And we saw significant improvement in behavior. I really appreciated the comments that were made about the need to work closely with communities, because when decision makers make policies, teachers are the ones implementing them, and we see the effects firsthand. And so teacher voice, I feel, is necessary for a whole perspective, a whole picture of what would create better change in early education options, because we understand the inner workings of our communities, and we bring just a different perspective on what would influence the effectiveness of recommendations. So I just wanted to say that please consider leveraging the strength of teacher voice when making recommendations. Thank you.
Thank you. All right, I will take one question from the chat and then pass it back over to you, Jess. Peter has a question. Workforce development may be the greatest issue in Chicago, across Illinois, and across the country. Our teachers are the backbone of the system. Will the Funding Commission make any recommendations for funding a system that develops current teachers and attracts new people to the field?
I'm happy to take a first crack at that. And I think, Peter, to your question, there's good news, there's bad news, and there's good news. The good news is that the funding adequacy calculation assumes the kind of wages that we know our teachers really need for this to be living wage jobs. So it is not assuming the level of reimbursement and wages that we currently have. I don't know the exact numbers. I'd have to get somebody from that, or maybe Elliot's got them. But it assumes them at a level that that makes this a much more attractive, well-compensated field. So that's the good news. The bad news, and there's really two little bits of bad news, you know, putting it in the formula is essential. It tells us where we need to go. It helps drive new dollars. It's going to take us a long time to get there. So just the fact that we're assuming that and wanting to build to that does not mean that we're going to have those dollars to spend immediately. So that's the bad news. The other bit of bad news is that it was beyond the particular pipeline development strategies, was beyond the scope of the commission's work. But the good news is there are actually several efforts underway around the state looking specifically at workforce development, specifically for early childhood. You know, there are, because the folks who come into that field and who are getting credentialed look a little bit different than folks who are coming into the K-12, for example. And so there are some strategies that are being directly tailored toward them. So I think you can expect to see some movement on that over the coming year, depending on what happens legislatively. So I hope that's more of a good news than a bad news sandwich. And appreciate the question, because it is, in fact, would agree with your premise that the more we want to expand what's available to kids, the more critical that issue is going to become.
Elliot, did you want to add any comments here?
No, I just second what Robin was saying, and think that it is a huge problem, and that we've tried to account for the need to create greater support and demand, but I don't have the numbers offhand. I apologize.
Okay, thanks.
Thank you. We had a couple questions about this. How will the recommendations impact the Illinois Gateways to Opportunity programs for childcare providers?
You know, this is a case where we didn't really get into the specifics of how the recommendations would affect every part of the system in that way, but we really assume that there will need to be changes in the entire system of professional development as we look at ways to not only provide more equitable funding or living wage funding over time, but also in making sure that those who are trying to improve their credentials and become better professionally ready to serve children have a system that really is not so difficult to navigate. And there are many positive things about the Gateway system, but all of the systems will need to be re-looked at with a lens toward addressing these issues of equitable access and the ability to really meet the goals that we've set for making the transformative changes that we want to see. So I think when you look at it that way, really all of the systems will have to be re-examined. But the specifics of what changes might occur, we're still too early to really say right now, because these recommendations will have to be implemented over a period of time.
Thank you, George. Jess, over to you for a couple live questions.
Thank you. I will kick it to Tasha. Tasha, you should be able to unmute and share your remarks.
Okay, thank you. Can you hear me?
Yes.
Okay, great. I have a question. With a comprehensive race equity analysis of the early childhood care and education landscape, the state can better determine the inequities in access to services and obstacles faced. Adding new resources to the existing child care and education system without a proper race equity analysis may end up perpetuating existing disparities. The Funding Commission did not start with that examination, and the state should not move forward in deciding what funding structure to use, whether it's a new calculation for awarding a grant or a long-time contract. So I would like to know, how would the commission handle this issue going forward?
So Tasha, we absolutely agree with your observation about the importance of really looking very, very accurately at the issues of disparity around race. And in fact, the commission did, as you may know, have a racial equity work group that made some, as well as a group of national panelists that made some very, very clear and specific recommendations that need to be incorporated into the commission's final report. And in fact, the impact of, even though, as you mentioned, we didn't start with that, one of the points that was, I think, became clear as we did the work is that each of the work groups that made some of the initial recommendations need to really step back before there's a final report and take those recommendations into account for many of the reasons that you're saying, because we have to know and we have to be data driven with regard to who's being served and who's being missed. And we also need to make sure that the actual very culture of the system itself is impacted by how we look at racial justice and racial equity. So there are a number of different ideas that have really been at the surface that really we feel are going to be essential. And I think you will be able to see very clearly in the final report of the commission as to how those are taken into account as we make our final recommendation and report to the governor. Others may have comments as well.
No, we just agree with that. It is a priority. It should be a priority. Working on it.
The business of data in transparency is a big part of this at the local as well as the state level. We need to disaggregate a lot of the data that we even do look at right now. We need to make sure that we're transparent about it in terms of, if the outcomes that we're still seeing in terms of our children's readiness for kindergarten, and we need to face those, very publicly. And we really would look at, we talked about the idea of local systems as being an important match to what the state does. And those local systems need to be doing the same work. And we need to make sure that folks at every level of the system are really working in a very aware and intentional way with regard to addressing those disparities and not having it be an afterthought.
Thank you. Jess, another live question?
Yep. All right, Stacy, you should be able to ask your question now.
Thank you so much. I really appreciate it. Can you hear me?
Yes.
Okay, great. My question is really twofold, and it's related to the inclusion of children with disabilities. That wasn't really touched on in this presentation. So I'm just trying to understand what the recommendations are going to be in regards to possible like additional funding for providers to include children with disabilities, like a rate increase or additional grants, and also what type of accountability is there going to be for providers and facilities who aren't including children with disabilities. Is there going to be a certain percentage of slots that children with disabilities need, that are reserved for children with disabilities in order to receive funding? Or is this an issue that the commission has talked about?
I can
Please.
take the first part of the
Yes.
question. So with regard to thinking about the funding, it's something we've been taking a really close look at as we model what an equitable and adequate system would look like. And we are actually doing, one of the slides earlier sort of showed a list of things that we've included so to date, and then more work that the commission is doing to really make sure that we have the right data to be able to make recommendations around, sort of ideal funding levels, sort of what, as Robin said earlier, like where we're going in terms of the funding levels that we would see as adequate. And so that's one area where we are still doing some more work, but it is absolutely something that's being included so that there is appropriate funding available to provide, not just services for any families that wanted to have affordable services, affordable care, high quality care, but also to be able to provide additional funding for children who needed early intervention or other supports in those early years. Maybe another commissioner can take the question about accountability.
Yeah, I think the foundation of accountability in many ways in the discussions that the commission has had is honoring the whole issue of parent choice and how that translates to, access to services at the local level. And that there were some very clear recommendations from the inclusion work group that to the other work groups of the commission around the importance of making sure that we're clear about not only what the intent of the the law is with regard to making sure that children and parents' rights to these services are honored, but also making sure that we look at how our systems of support and care really support that choice. Oftentimes, parents are left with having to ask for an IEP hearing if they're not happy with the options that they're given or feel that they're not really the ones that best serve their child. And that's really kind of a nuclear option for many families, because that's a big thing for a family to take on when they're just trying to get their child served. So I think what we really want to see happen is that, that the systems are supported in a way, that the providers are supported in a way that they really can honor parent choice and preference with regard to where their children are served and so forth. But we also felt that there needs to be more examination of EBF with regard to really whether it is in fact adequate in all cases to really serve the needs of children. And then the last thing I would say is that because there are multiple sources of funding that support special education and children with special needs, we have to understand the totality of the impact of that funding. And so we feel that there's a lot more work to be done with regard to both the funding formula and making sure that it truly is equitable and fair, and also with regard to making sure that providers have what they need to really be able to respond to parent choice.
Thank you. Jess, I'll kick it to you still for one more live question, and then I think we'll have time for a couple more from the chat box. And maybe just in the interest of time, I'll ask maybe that just one commissioner answer each question moving forward. Jess, to you.
Yep. All right. We've got Dr. Montgomery next.
Hi, good evening, everyone. My name is Shanor Montgomery, Dr. Shanor Montgomery, and I just have two questions. I am a current administrator in the south suburbs, and one of my big questions is, what is the system? Is this commission going to look at how the teacher certifications are going to be monitored now that they allow for the gateway level 5 and 6 teachers to teach in the early childhood, how that process will be monitored? And then the second half is about mental health, and how will this commission look at that across the system, those services for early childhood?
So your first question was about monitoring. Um, I don't know, again, that we've gotten so specific into monitoring in terms of specific recommendations around the monitoring system. But I think that if we look at a change that really would affect the entire system around how services are provided and how accountability is set up, I can't imagine that we would not see also some changes in monitoring. One of the challenges that a lot of providers face with monitoring is just the fact that there are so many different systems and different funding streams that monitor them differently. And so oftentimes it becomes sort of burdensome to really deal with, monitoring and how it's done and who's monitoring you at a given day. So, but the entire process is streamlined and put into one agency, should really result in better and more consistent monitoring for all aspects of the system. But we didn't get into that particular detail that you're referring to. I don't know if I answered the other part of your question, but perhaps someone else can respond if they would like.
You actually did.
Okay, thank you.
Thank you. I think we have time for a couple more questions. Did parents participate in the commission, or were there any opportunities for direct input by parents?
Yes. There have been a number of different focus groups and other opportunities for parents, and we really expect that there will be more going forward in terms of making sure that we are hearing. That was one of the biggest recommendations that came from a number of our different work groups, is the need to make sure, and from our expert panelists as well as from our racial equity work group, was that we need to make sure that we are listening to more and more parents.
Thank you. And I suppose maybe this is a good final question before we move on. What happens next after you submit your recommendations to the governor?
Well, the obvious next step was really for the governor himself to review the recommendations of the commission, and then to make some choices and decisions about what moves forward and in what manner. I think it's clear that some of the recommendations that are coming out of the commission, to the extent that it's feasible, are already being taken up by state staff within the system in terms of looking at ways that they can become more in line with the kinds of principles and practices that the commission is recommending. So even to the extent that it's feasible to begin to really look at improving the way in which some of the systems are currently operating and looking at their work, that's being done even without a completely changed system, but that we know that that's limited. But really, ultimately, the governor himself is really going to have to decide on the next phase of this, based on how he responds to the recommendations from the commission.
Well, let me just chime in with two things. George gave you the most important part of the answer, but I'll add two notes. One, you can expect, I think, to see in the report some next steps that we think the state ought to take, and some ways to take this work forward. Again, you may be asking yourself, my gosh, we've got no money, how can we possibly do that? The good news is that some of the next steps are not as funding intensive. There are federal grant dollars that could be applied and used. So the path forward on this, there really is one. And the second, and I say this knowing that we've got some legislators on the call, is there's going to be some, I think it's not entirely what the governor will do, though that is pivotally important. And he is the one who set this up. And I know that he's looking to do some things. But I think there's going to be some, the legislators, it's going to be up to the legislators as well, because there are going to be pieces that are going to require legislative action. There's certainly going to be a role for legislators in funding decisions going forward as well. So they've got some fun work and important work ahead of them as well.
Thank you, everyone. Before we close out, I think Representative Bennett, you wanted to say a few words?
Thank you. It's really more of a comment and a thank you in a number of ways. George, I kept thinking ever since you said it, readiness for kindergarten. It really captures, I think, everything we're talking about here tonight. If the kids are ready going in for the kindergarten piece of that, of course, there's a ripple effect all the way through. If the kids aren't ready for it, you have the same ripple effect that just slows everything down in so many ways, so many opportunities that we need to find a way to help our kids move forward. And so I really appreciate the questions tonight. I appreciate all the effort from the commission to work through these things. It's a lot of parts and pieces that are coming together, and I really, again, appreciate all the efforts to make this, basically to get us where we are today. So thank you, really appreciate it.
Thank you, Representative Bennett.
Yeah, you bet.
Thank you to all the commissioners for joining us tonight, and thank you, Steffi Hernandez, for your interpretation skills this evening as well. And thank you again for everyone for joining us. And with that, we will close just by highlighting some opportunities coming up. As we mentioned, there are 2 more town halls, one on January 6th at 8 p.m., January 14th at 8:45 a.m. I went ahead and dropped the registration links for those town halls in the chat box. And of course, if you would like to continue these conversations, there is a coalition of people who love talking about this stuff, and we meet every month. And our first in 2021 will be on January 7th. And I'll be sure to get our sign up form in the chat box as well. Thank you so much, everyone, for joining us.
Thank you.
Good night, everyone.
Good night.
Great job, everybody. I know folks are just still dropping off, but I want to say great job. And hopefully we are capturing the question and answer and the chat box comments. And I'm trying to jot some stuff down too.
Yep, will do.
Lillian, can you stop the live streaming?
Oh, I just passed it over to Jess. The host over to Jess. Sorry, I just saw that you tried calling me as well.
Okay.